So if Julia is watching, a dirty chai is part chai tea, part coffee.
That's the topic for today, right, Alan?
Yeah, that's what we're talking about for an hour. Jessica Chung is a patient education specialist at SeamlessMD, where she designs interactive care plans for patients, including cancer care and specific cancer surgery programs. Jessica has a Bachelor of Science degree in biology and a minor in chemistry. She also has a Doctor of Pharmacy degree from the University of Toronto. As a registered pharmacist, her passion lies in medication management, opioid use reduction, and providing easy to understand healthcare information to others. When she's not working and when we're not in a pandemic, Jessica loves to travel and check off her adventure bucket list. Jessica, welcome to the show.
Thanks, guys, for having me. I'm excited to be here.
Hey, Jessica, actually, sorry, Alan, I just want to hijack the first question, if that's okay. It just came to mind. So, Jessica, I mean, I can't think of too many people who've started in pharmacy and then moved into digital health. I was curious, could you maybe share with the viewers what got you excited about digital patient engagement in the first place, and how you went from clinical pharmacy to I guess to being at Seamless?
Sure. I think I wanted a change in pace. I wanted a change in my own lifestyle too. I know being in pharmacy, I was working in a community pharmacy for the most part at Shoppers Drug Mart, and the pace there is very different than in an office setting. I wanted to explore a new place to work. And I found that in pharmacy, it's kind of a routine. I'm doing the same thing every single day. I'm meeting the same people, and it gets very robotic at times. And I wanted to learn more. I wanted to learn more about patient engagement, and it really is the future of healthcare, I think. So it was a great opportunity I found with Seamless, and I know that Seamless was working to find people to work on their opioid reduction modules and medication management. So I thought it was, an awesome opportunity to grow in both my knowledge of medication, but also in other areas of healthcare, like cancer. Yeah.
Awesome. Well, we're thrilled that you joined us. So thanks again for the time today.
Yeah, absolutely. And Jessica, we'll have to have you on the podcast again, assuming this one goes well, which I'm sure it will. But to talk about opioid reduction and the different opioid modules that you've built on the platform. But today we do want to highlight your work on our cancer care programs at SeamlessMD. So far on this podcast, we've talked about different surgical programs that we built digitally. And today we're going to highlight cancer care, which is obviously different than surgery. Maybe to start, Jessica, could you explain some of the high-level differences between what constitutes a cancer care program versus a surgical program on digital patient engagement?
Sure. So I think the main difference is that with systemic therapy and radiation, they're not surgeries. So they're definitely not surgery programs. So they fall under Seamless's non-surgical programs, and more specifically, they fall under episodes of care. So, cancer care is a journey, and surgery may be one of the chapters in that journey, but also includes, immunotherapy, targeted therapy, radiation. So episodes of care allow for a clinical team member to toggle on modules on top of a patient's program when it applies to them. So let's say a patient starts on a breast cancer program, and then after some time passes and they're in their recovery phase, they find out that they need to start immunotherapy. So the clinical team can easily toggle on an episode of care and then switch them into that new phase of care. It's more seamless. It's easier for the clinical team as well as the patient, and they're just already on that next phase of their journey, so it's a lot easier and manageable. I would say that's one of the most high-level differences. Another major difference is that in these programs, we focus a lot more on medication management as well as treatment adherence. So I would say a lot more than in regular surgery programs, just because we're actually dealing with more medication here. So whether that be medicine that helps your immune system, or targeting genes and proteins, or chemotherapy to kill cancer cells, it's really focus on protocols and how medication is delivered and what to expect of your medications. Yeah.
And I'm assuming, so the actual features and functions of the technology are pretty similar. So it's, reminding patients of certain medications, and obviously tracking their progress through different survey questions. Education is always delivered at the right time for the patient. How do you kind of go about mapping that entire journey, since this isn't an acute, episode where it's just a surgery? It is more of a chronic condition. Is there like specifics in terms of the actual functionality of the platform that you're leveraging, or how do you kind of break it down into almost bite-sized pieces of this journey?
Yeah, so in our regular surgery program, it's a lot more linear. So everything is circled around the surgery date. So it's things that patients have to do before surgery and then during their hospital stay, then after discharge. But with chemotherapy and radiation, it's like cycles. So these treatments are coming in. Patients may be taking these medications on a daily basis. They may have to go into clinic or hospital to get treatment at certain appointment dates. Even radiation, they have to go in for treatment planning first, and then more radiation where they get that delivered. So it's a little bit different. It's not so, it's not linear. It's a lot more flexible, I would say. And the way we build it is around patient characteristics, and appointments are going to be based on application events. So it's all going to show up on their to-do list, but it's not so, pointed on a specific date. We have this new feature on our platform where appointment dates can be shown, and all past appointments and future appointments will be able to be seen. And so that helps patients keep on track in that way too, even though it's not so, you're 30 days out from your surgery date. Mm-hmm. So that's a new build that we're trying to explore that will be helpful in chronic care. Because like you said, Alan, it's not so it's not so straightforward, and people have to be flexible in that.
And Jess, I'm curious. So, in terms of the feedback that you're getting from different types of healthcare stakeholders. So, for example, I know in surgery, often you're working with surgeons, anesthesiologists, maybe nursing staff, OT, PT, others kind of more focused on that acute surgical episode. When it comes to the cancer journey, who are the, I guess, number one, like who tend to be the different, maybe the oncology type providers you're engaging with now instead? And then also, do they have concerns or needs for patient engagement that are different than what an acute care nurse or surgeon typically has been asking for before?
Mm-hmm. So I think one of the differences are that there's a lot more psychological care involved in cancer. So I do speak with oncologists, radiotherapists, and then the clinical team in surgery. But there's a whole section on psychology, psycho-oncology, that's not really explored, and anxiety is a big thing in cancer. So we try to make sure that piece is built in, and a lot of the clinical team actually don't spend too much time in that area. And so they asked me to really focus in on that, helping patients, cope with their cancer. How can we come up with a program that really sure, we have all the clinical information, but also target that area that's not really focused on really, and it's undermined. And it really should be like a partnership, really. It's a clinical piece as well as a psychological piece, an emotional piece. So I think that would be, or that is a section that the clinical team is actively working on, and they see that there's a need for that piece, and they're giving me resources too, but it's really a partnership, I would say. And a lot of clinical areas, they're working on that piece, I would say. So I don't know if that really answers the question.
Yeah. And I guess you mentioned, and made a good point, that the psychosocial element, even though you do tend to touch on it in I think the surgical programs as well, it sounds like it's a bigger thing in the patient journey for cancer care. So I know often for a patient who's had surgery, I know a lot of our digital care plans, you're tracking, mood and anxiety after a surgery. Are you continuing to track that throughout a patient going through chemo radiation? Like, how long are we tracking that for? And are there any other psychosocial elements that you may be having the patient track that are unique to the cancer journey that you wouldn't do for surgery?
Right. So you're right in saying that, you know, in the daily health check in all of our surgery programs, we track mood and anxiety. But with our chemo radiation programs and survivorship, we built in something called a weekly distress thermometer. And so this is really a tracker that's going out weekly to track distress. So, you know, many cancer patients, like we mentioned, are experiencing psychological suffering from the moment of diagnosis all the way to end of life care. And so the psychological distress can really become severe enough to interfere with the ability to cope with cancer. So it's important to find, you know, if patients are experiencing distress early, we need to prevent it early. Early detection is key, and then proper management of that for the whole time. So we monitor distress quite closely. So a weekly basis. We try not to probe on it too much. So it's not a daily thing, but we do it weekly, which is a lot more than patients would get at their survivorship follow-up meetings, because those are typically done months, like 3 months or 6 months in terms of time. But we are doing it weekly, and then making sure that the clinical teams are reviewing that so they can intervene if needed earlier on.
And just so listeners are aware, because I'm a newbie to a lot of the oncology patient-reported outcomes. So this distress thermometer is just like the NCCN one, National
that's right.
Cancer Network.
Yeah,
Gotcha.
that's right.
So I'm new to this. So it's kind of like it's almost like the shape of a thermometer, and I guess I'm just looking at it online, and it's kind of like the patient has to. It sounds like they're recording from 0 to 10, like their sense of like mental, physical, or social distress every week. You're saying?
Yeah, it targets, you know, practical problems. It targets things like even family problems, emotional concerns, and also the physical. What are the distresses coming from? And they can rank it from 0 to 10, kind of like how we rank our mood and anxiety from 0 to 10. So it's kind of similar in that way.
And just I'm curious, like from your conversations with the oncology providers, at least the groups that you're working with, are they currently having the patients track that emotional distress thermometer data like weekly on paper or verbally right now? Are they not tracking it at all? I'm just curious how what we're doing is different than what they're doing right now normally with patients.
So typically these patients are given a paper. So the distress thermometer is printed out for them, and they fill it out before their survivorship follow-up meetings. So it's only given to patients once they finish their chemotherapy and radiation. It's not given earlier. Once they go into their survivorship phase, during their follow-up meetings, which happen maybe once a year, every 6 months, they're given this paper. And people are finding that may not be enough.
Right.
Mm-hmm.
But so the idea is that, I guess in this case, like do you have care teams who are going to be like getting alerts if the patient's trending in the wrong direction, or like, what's your sense of how they're going to use that more weekly data going forward?
Yeah, so I don't imagine it to, they're not going to reach out so much, but if they see a pattern or they see that the patient has been reporting, this is a level 10 distress item for me, and they see that happening on a consistent basis, they're going to reach out sooner than in 6 months or sooner than in a year's time. And patients, I don't think that these are things that doctors care about for them. They might just think, no, the doctor just wants the cancer to go away, but there's so much more that happens, more than just the physical aspect of it. And this is all part of cancer care. It really should be.
Absolutely. Just I'm curious when one of the things that we often do at Seamless is I know I'm so curious this one. I mean, one of the things that Al and I talk a lot about is with every clinical program or surgical program or whatnot that we work with. I know your team often interviews patients and asks them about concerns they've had going through a certain healthcare journey or whatnot to help inform how you design these programs in a patient-centered way. Were there any really unique topics that came up when you spoke with patients who've gone through a cancer journey that may be different than someone going through a surgery or a chronic condition?
Yeah, so I really think they're similar. But one patient I did speak with, she was a breast cancer patient, and she just told me that she's anxious all the time. Anxious to the point she can't sleep at night. She's crying. She really feels like no one can relate to her. And the anxiety is really around not knowing what to expect. Side effects. How long is the side effect going to last? Will I lose all my hair? Like, is cancer ever going to go away? Is it going to come back? Does radiation hurt? So it's these questions that keep patients up all night, and they're scared about pain. So I would say anxiety is a huge thing with patients in all of these interviews I've done, as well as there's this feeling that people, lose security of feeling cared for once they leave a hospital setting. So they may feel very safe and know that people are listening to them when they see a healthcare provider in front of them at appointments. But once they leave that setting, it's like, who's caring for me now? Who's looking at my reports? So they lose that sense of, feeling cared for. And I think that's where Seamless can really come in and, show that someone's actually right by your side at all times and can give you the appropriate next step when you need it most. And I think that's, in my research of other apps out there, that was the element that was kind of missing. There's no follow-up and there's no recommendation. They kind of just leave the patient in the dark after they report something.
Yeah, I think one of the things that we often have been asked about at Seamless over the years is in terms of how we distribute it or get into the hands of patients. Should we be more direct to consumer, or should we just keep working with healthcare providers and hospitals as kind of the channel to get Seamless in the hands of the patients? And the thing that we've always kind of gone back to is, yeah, we could go direct to consumer, direct to patient, but then if it's a direct to patient program or application, then it's very much a one stakeholder program. It's not connected to a provider. Your care team won't know what's actually going on. No one's actually having the option to monitor that data and stay connected with you. But if you wanted to go to a platform that would keep patients connected with the healthcare team, then you kind of have to go through the healthcare organization to make sure that it's been approved there, it's vetted, it's secure, they're bought in. And so that's kind of why we've just always stuck to working with organizations, so that that way we know that they would actually use it to be that companion for a patient and keep an eye on them. So it's always been it used to be an ongoing conversation. Now I think we've kind of settled on, well, the only way to get the full experience for the patient is frankly to go through the organization. It's not necessarily the fastest way to get in the hands of patients, but it's a way to actually make sure the patient gets more than just an app. I'll put it that way. You know what I mean?
Yeah.
Yep. And kind of tagging on to that, the real benefit of digital patient engagement is providing that value back to the patient. So if they're, taking these distress thermometers and they're filling out that they're feeling anxious, they don't just kind of put that answer in and then they don't get anything from the program. They're actually given instructions on, here's maybe how you can manage some of your anxiety, or here's instructions from your care team. Do you think you could talk a little bit about some of the unique characteristics or unique features or education that you've built into the program to provide that kind of value to patients once they've answered some of those questions?
Yep, sure. So I'm going to speak on the treatment adherence piece and medication questions. So a lot of patients will report that they have a side effect and don't know how to manage it. And so then we give them over-the-counter recommendations if that's warranted. If they're experiencing something like fever and they're on chemotherapy, that will warrant them to call an ER or go to the ER. But when they're on immunotherapy, they'll actually have to just call their oncologist. So it's very different in terms of how to manage side effects depending on your treatment type. And it's very good that we have these setup surveys that collect the patient's information when we start the program. And so we can tailor the rest of the program to them. And I know that's, sorry.
Just for folks who maybe don't know, who are listening, the program is intelligent to set up different characteristics or different profiles for the patient and then tailors the app that way, the experience, or how does that work?
Yeah, so for example, if a patient were to start their program in systemic therapy, we'll ask them a question: where are you getting your treatment done? Are you taking your treatment at home, or are you going into appointments? And so all of that will set up and it will change their to-do list. So for example, if a patient is getting their treatments done in hospital, there's a protocol that they have to follow. So, you know, one day before their treatment day, they have to start taking their steroids to help with the inflammation. And then after their treatment, they're going to have to use their injections that are given to them in the hospital. They'll have to do that injection at home, and we'll give them instructions on how to do that to prevent infection, post therapy, you know, anti-nausea medications, but those may not apply for patients who just take regular chemotherapy at home. So patients who take regular chemotherapy at home may have to take, you know, dexamethasone mouthwash 4 times a day, and maybe people who get radiation won't need to do that. So it's very tailored. Not everyone has to do everything, and so we keep it simple, give them the information they need to follow, and kind of cut out anything that they don't need based on how they set up their PCs.
Jess, besides the distress thermometer, I was wondering if there are any other patient-reported outcome surveys or tools that have come up in your conversations with oncology programs? Just because I know a lot of our listeners are very big into PRO, so I was just wondering if there are any other ones that have come up in your conversations.
Yeah, so there was one more called the monthly quality of life check-in that we have built in. I don't remember which validated survey that was from, but it was a validated survey. So we have our weekly distress thermometer, our daily anxiety and mood tracker for that, and then we have our quality of life that's given on a monthly basis.
And I'm guessing that's not something that they were collecting normally either. So I think that's one of the unique things about going digital is that you're going to have just frankly a better, I'll call it map of what's the patient experience going through this. And I mean, who knows what will come out of that data and how it helps providers better care for patients or help patients better understand, you know, looking back what that experience is like. So that's definitely really interesting. I was also wondering, and again, I don't know if we're doing this just yet with our partners, but I know in the past when I've talked to providers about oncology, there were talks about during the surveillance phase, like long term, one of the challenges they face is actually making sure patients come back for, you know, getting their scans done and those checkups and all that. Like, are we getting engaged in any of that right now, or is that a later in the future sort of thing?
So we have the education pieces built in, and I think you're right, Josh. A lot of patients kind of fall off the map because they're scared about going back to their follow-up visits. There's a lot of anxiety around that as well. So giving patients education earlier on, we have a whole section in our education library about screening tools, as well as what to expect in your follow-up, how often these follow-ups will be done, and why it's important for the patient to be an active participant in their care. And attending these follow-up appointments is really important in cancer care for the surveillance piece. So we have education, you know, learn how to prepare for these, what to expect. And these kind of elements will help patients, you know, be better prepared and maybe want to go to these appointments more than if they didn't have that information.
Right, or at least feel more empowered to do so and as an active participant. It's interesting that I'm noticing a similarity between our surgical programs and what makes them successful. And it sounds like a lot of it comes down to setting the right expectations for patients and communicating kind of the why behind certain education pieces. Given that there is a much longer journey sometimes with cancer care programs compared to an acute episode of surgery. How are you going about designing some of the education and explaining why certain things are important if there isn't really an exact timeline to some of these pieces? Is there a specific methodology that you're using or any clarification that you have on that thought process?
Yeah, well, the language that we use for this patient population has to be extremely sensitive, first of all. It also has to include all of the other things that Seamless is great and is known for, so usability, keeping people engaged and making it very simple. Everything is at a grade 6 reading level or less. But I'm going to tie this back into the psychological distress. When patients are in distress, it's harder for them to apply behavior change. So it's kind of like the cycle where if we're not dealing with the psychological conditions like anxiety, depression, insomnia, delirium, it's going to be harder for them, to apply behaviors. And behaviors in cancer care are really, what's the behavior that will lower the risk of cancer? So it's kind of similar in surgery where, stop smoking, alcohol consumption, diet, exercise, and then we have things like oral care and sun exposure in cancer. But yeah, it's just so much harder, and they may not want to change their behavior if they're in so much distress. So that prevention piece, and it's super important to have, I think, this weekly distress thermometer going to see if we can catch it earlier and then help promote and motivate patients to change their behavior, because there's a lot of things that the patient has to do on their end as well. But it's hard to tell patients, you have to do this, when they're not in the mood. It's really hard for them. So just that sensitive language and making sure that, we're checking up on their mental health and other elements really helps, I think.
Just that kind of reminds me, like, one of the really unique things that we do as a healthcare company is that, if we were, I don't know, if we are working on Microsoft Outlook or on Slack or some other software, I mean, let's be honest, like, you're not really being used by people when they're in a time of distress. I mean, yeah, maybe you're stressed out about something with the customer, who knows, right? But you're not really often in person distress about, like, in Outlook or Slack or Zoom or something like that. But when you're talking about a patient going through something like a cancer journey and having to use a product as part of that journey, that's a very different setting than just someone who's like at work using Zoom, using Slack. And I think you made a really good point that there's some unique challenges that we face in engaging patients through a very, very sensitive, difficult time, which also means we have to have a very, like you said, like compassionate and empathetic approach to how we design the experience. And I think that's one of the things I think I mean, not to toot our own horn, but I think we do well at Seamless is we don't view it as like, oh, it's just an app. Let's just build features. People will use features. It's not like any other product. We have to be very thoughtful about the overall user experience, and not user experience, patient experience, really.
Yeah.
So it's really nice to hear that you and the team have put so much thought into how you look at the patient journey. That's really important. Not a question, just a statement.
Yeah. Definitely. I don't actually have any additional questions for this podcast episode in terms of cancer care, Jess. I think you've highlighted, some really fantastic points on how we've programmed and designed a cancer care program that's different than a surgical care program. Lots of food for thought in there, and I hope our listeners can take away some of the lessons that you've learned in designing this program. At this point, unless Josh has other questions, I think it's time to jump over to the Fast Five. Just looking at the time. So for folks who don't know, again, Fast Five is 5 really quick questions where we shoot them over at Jess, and Jess can answer them as succinctly as she would like. The first question that we have today, Jess, is do you have a favorite book or book that you've gifted the most?
So one of my favorite books, I think, is Where the Sidewalk Ends by Shel Silverstein. So it's actually not really a book. It's more of a collection of children's poems. And I started reading it when I was in grade 3, and it just really stuck. I think there are great messages in there, and it's just been my favorite.
Wow. Alan, have you heard of this book? For some reason, I've never heard of this book.
No, it's great. I think what I like about it is you can read it in like grade 3, grade 4, and you understand, bits and pieces. And then you read it now as an adult and you take away a whole different meaning from it, but it's still just as great. And I like the illustrations are amazing as well in that book. So it's awesome.
I'll have to look that up.
Yeah.
Oh, he wrote The Giving Tree?
Yeah, he did.
Wow. Okay, cool. Sorry, go ahead.
Another favorite book.
It is a good one, yeah. Question number 2, who is a person, either dead or alive, who you'd love to meet?
Honestly, I just want to meet my friends and my family right now. It's
Oh,
it's
fair.
it's the pandemic. It's been a long time since I hung out with people. And now that we're in another lockdown, I think it's going to be hard again. But yeah, I just miss my friends and my coworkers.
Hmm. Yeah, I feel that.
Wait. Can I ask you an alternate question then?
Yeah.
Who is a person, dead or alive, that you'd be thrilled to be in isolation with?
Yeah,
Oh
that's
my
fair.
gosh. Oh man. Um, Probably my seamless coworkers. I feel like it's really fun at work and I really miss it. And I think just being stuck in isolation with you guys would have been great.
So doing this podcast in person.
Yeah, sure. I
Yeah,
just really miss the office and the dynamic there. Yeah.
Yeah, it's
us
pretty
too.
good. Question number 3, Jess. What is your favorite food?
So my favorite food is something called kanjang kejang. And it's basically this Korean side dish, but it's marinated blue crab. It's marinated in soy sauce. It's very spicy and really
Ooh,
yummy.
Huh.
that's amazing. Yeah,
Yeah, I've never had that.
that's great. I'm gonna look that one up, Jess.
Yeah.
Question number 4. Would you rather have super strength, super speed, or the ability to read other people's minds?
So reading people's minds is very, it's too much information, I would say.
Okay.
So maybe speed so that I
Mm.
could travel without a commute time.
Hmm.
Yeah.
That's a good one. Yeah. Last question that we have is COVID-19 related, and I'm sorry, Jess, maybe you're sick of this pandemic and you're over it already. But what is one hobby or activity you've gotten into since the start of the pandemic?
So it's really random, but ever since the start of the pandemic, I started watching MRE videos. So I don't know if you guys know what MRE is, but it stands for Meals Ready to Eat.
Okay.
And I'm specifically interested in army rations. So I
Oh,
just watch this random guy on YouTube open up
Dang.
different army
Yeah.
rations, all different types, and just watch him eat it.
Huh.
It's very strange, but
So
I've done it every night.
are these packages you can actually buy, or this is just for the military?
No, so it's available to purchase off of different
Oh, wow.
websites like Emery Mountain, um,
have
and
you
they
bought?
have all the flameless ration like heaters in them.
Oh,
So
cool.
it's
Wait,
really
Jess, have you bought any of these?
no, but I kind of want to. It's on my wish list.
Yeah,
It can't taste that good, right?
No, I don't think so. It's just for the experience.
true. Yeah, I feel like that. I mean, it would be useful when you're traveling, you're camping, or something like
Yeah.
that.
Hmm.
That'd be pretty cool.
Hey,
Awesome.
so if anyone's listening and you want to get Jess a Christmas gift, you got to get her some.
MREs, or even just the video of you opening an MRE package. Jess will watch that.
Yeah, it's
Well, awesome.
entertaining.
Fantastic, Jessica. Thank you so much for being on the podcast today. Your episode on cancer care is definitely one of the unique ones that we've had so far. Lots of great information in here that I've learned about. This is the first time of me hearing a lot of this stuff. So I really appreciate some of the insights that you brought. I would love to have you back on the podcast again to talk about like these opioid modules that you've built in, and obviously that fits in well with the cancer care and surgery programs as well. But that's obviously an invitation that we'll send out to you another time if you're interested.
Sounds good. Thank you both.
Thank you, Jess. Great job. Appreciate your time.